Welcome, everyone, to today's important session on Narcan, which is an invaluable tool in the fight against opioid overdoses. Opioid overdoses have become a critical public health issue affecting communities across the globe. Today, we're here not just to raise awareness, but to empower each and every one of you to become a potential lifesaver. The opioid crisis is a complex challenge, but one key element in addressing it is education and preparedness. In this presentation, I will delve into Narcan, what it's used for, why it's crucial, and how you can play a pivotal role in saving lives within your community. My name is Eunice Mathis. I'm a registered nurse. And I have presented this video, this guide, to help educators and students learn how to actually administer Narcan and just become more prepared if they have to save a life. And here are some of the permissions. I, Eunice Mathis, hereby grant educators permission to use my work, Saving Lives Together, a guide to Narcan and overdose prevention for educational purposes. Users are required to provide proper credit by acknowledging me as the original creator. This permission is non-exclusive and does not transfer any ownership rights. If you would like to request a copy of the slides so that you can make your own presentation for your students, just visit our website, which is fltraining.com. Once you're there, click on the Contact Us page and just send an email. We'll be happy to share the slides. Again, you can use our video in its entirety as long as you give me credit. All right, so the overdose prevention and education pre and post test. If you are watching it live, you can always come back and watch it later. But in the future, we would really recommend that you take out your cell phones and use your camera app on your cell phone to actually go to the pre-test. And with your camera app, you just hover over the QR code and it's going to send you to a test link. The reason why we want you to do a pre-test and then answer the same questions again at the end of this presentation is we want to know what your baseline knowledge is. Knowing what you know, what your misconceptions about Narcan and drug overdoses, it's beneficial to us because it will allow us to change the way that we present, maybe change some of the materials. But then at the end, we actually want, proof to show that, hey, I've learned something from being in this presentation, from being with Nurse Eunice. And on top of that, I'm more prepared to help save a life in the event of a drug overdose. So let's talk about understanding how opioids can contribute to death. And in a few slides, we'll actually talk about what medications or what pills we consider opioids. All right, so opioids sit on cell receptors, and cell receptors mainly in the brain. And whenever it does that, it causes a reaction. And this reaction causes the cell behavior to change, which can cause respirations to slow. Because the person isn't breathing normally, they have a lack of oxygen that can not only cause brain damage, but if the oxygen levels get really low, it can cause the heart to stop. And that's when death can occur. So whenever someone's taking these illegal drugs, the opioids, they are known as respiratory depressors. They will slow down the respirations because of the cell receptors. So how does Narcan, naloxone, how does it reverse an opioid overdose? Narcan is an opioid antagonist. It works by blocking the effects of the opiates on the brain and by restoring normal breathing. And all of our students at Florida Training Academy, if you take a CPR or a BLS course, we have Narcan kits. And so if you're not in Jacksonville, just stay until the end of the presentation and we will tell you how you can get your actual Narcan kit with medication. We'd rather you have it and not need it than need it and find someone who's possibly overdosing on drugs and not have this life-saving medicine. All right, so which medications or drugs are considered opioids? In other words, what will Narcan work on? Morphine, hydrocodone, codeine, oxycodone, fentanyl, heroin. You all, I hate to tell you, opioids are in everything now. So the illegal street drugs are laced So it could be marijuana that's laced with fentanyl. It can be cocaine that's laced with an opioid. So don't assume that because someone's from a different demographic, because they're a certain race, they don't look like they pop pills. It doesn't matter. The opioids are in everything. And so if you have somebody who's unresponsive, and we want you to treat them, possibly do your assessment, we'll talk about in a few moments, as if they have overdosed on an opioid to help save their life. All right, so what are signs of an opioid overdose? All right, so signs of a drug overdose or medical emergency from heroin, fentanyl, the other opioids we discussed, and prescription pills could be the person is awake but unable to talk. So they're in like a stuporous like state. You're tapping, they're not really vocal, they're just kind of staring off, or their body could be limp. They can have shallow or slow breathing. Their skin can be pale or ashen or clammy, means it's kind of moist. Whenever it gets really bad, they can have loss of consciousness. And we'll talk about how you can, actually check for responsiveness on one of the next slides. All right, so this is an example of somebody who has the blue lips, okay? And I do apologize, my screen isn't showing well, but this says the death rattle. And let's talk about the death rattle. Because the person is unresponsive, they're still breathing, but they're unresponsive. They're unable to clear their airway. And because the medications could have actually caused their stomach to become irritated, the person could have vomited, but they're unable to clear their airway. So those moist lung sounds could be a sign the person has aspirated. And if you come upon a person who's unresponsive laying on their back and you hear the death rattle, go ahead and put them on their side to try to clear out their airway while you're, putting on your gloves, getting the Narcan ready. But that would be something you can do to help those lung sounds. Right? If you know how to take a carotid pulse, they could have a slower heart rate. The pinpoint pupils, when you look at the very small pupil, this is the sign of a drug overdose. And so the normal pupils will constrict properly to be 2 to 4 millimeters, but that pinpoint pupil, that really small pupil, would be a sign that this person could possibly benefit from Narcan. And we talked about unresponsiveness. In a few moments, we'll talk about the sternal rub and how you can check for responsiveness. And here we go, recognizing and responding to an opioid overdose. My screen is not behaving. It's not doing what I want it to do. It should say sternal rub on one line, but it came down. So the sternal rub is a commonly used method of assessing response to a painful stimuli in assessing the neurological status of an individual. And so I have the red arrow pointing toward the rib cage. If the person has on a lot of clothing, it's going to be harder for you to do the sternal rub. So I recommend that you first start off by tapping on their shoulders very vigorously, aggressively. You're trying to wake them up and you're saying, hey, are you okay? Do that for about 3 seconds. Then unzip the jacket. You take your knuckles, form a fist, take your knuckles, and you rub it up and down their sternum for about 3 to 4 seconds. If this person was arousable, they would, of course, tell you to stop. They would moan. If none of that is occurring, you need to take out your phone, call 911, because this person is having a medical emergency. Right? And so this is another image of someone who is on the ground, and I do apologize. My slides are not doing what they're supposed to do whenever I am live streaming. So this says call 911, but we have a person who's on the ground, but this person could actually be sleeping. And so we're just not going to go up and assume that the person's in respiratory distress. We're going to tap on the shoulders first and then lay them on their back if they're not responsive. Once we tap them on the shoulders and say, hey, are you okay? Open up that jacket, prepare to do the sternal rub, take out your cell phone and call 911 and let them know that you have an unresponsive person. There are some other assessments that need to be made. We'll talk about those on the subsequent slides, but this is a Narcan kit. And again, if you're in Jacksonville, you come to Florida Training Academy, we'll be happy to teach you, prepare you to use Narcan, and you would be able to leave with your Narcan kit that actually has medication. And so whenever you have someone who's a victim of a suspected opioid emergency, first you want to lay them flat. Okay, so you want to lay them flat and check for slow breathing or unresponsiveness. You would then take the Narcan out of its packaging, insert the nozzle into the nostril, and you would press firmly on the plunger. Then don't forget to stay with the person. You need to stay with them because sometimes the opioids, the medications in their system, last longer than the Narcan. So you're going to stay with them and wait until 911 or those emergency responders actually arrive. And so rescue breaths, with the rescue breaths, I have a pocket mask with a one-way valve. And I think this is significant because if they stop breathing, you do want to provide ventilation. You do want to give them breaths. However, I want you to be safe. And so if you look in the image, this rescuer has on gloves. They have a barrier so their mouth isn't touching this victim's mouth. If this person would have overdosed on fentanyl, you don't want to come in contact with that. So if the scene is unsafe, you would not approach number one. If you think or if you know the person has used fentanyl or something that may have fentanyl in it, and you decide to, render aid, make sure that you have on your proper protective equipment, such as your gloves. And if you're going to be giving breaths, make sure you use the barrier device, such as the pocket mask with one-way valve. In this video, I will not be covering CPR. I have numerous videos on YouTube that cover CPR, but just know that if you're giving Narcan to somebody, if you come upon them and they're not breathing, Narcan is not your priority. Performing CPR and possibly giving rescue breaths would be the priority. So if you don't have any protective equipment and you don't want to risk your life by giving this person rescue breaths, you can do hands-only CPR. Whenever you're performing hands-only CPR, you're still helping to save their life. The blood, the oxygen that's within their blood, it hasn't evaporated. It hasn't dissipated. It's still there. It's just not moving because the person's heart has stopped. Remember, if they stop breathing, the heart muscle is going to also stop because of the lack of oxygen. So we need for whatever oxygen is still there for you to help circulate it, to help save them, to help save the brain. So you'd be performing high quality CPR. You can do hands-only CPR without breaths and still save the person's life. We normally compress at a rate of 100 up to 120 compressions per minute, minimizing interruptions to no longer than 10 seconds. And you want to compress deeply enough, at least 2 inches for adults. Or if it's an adolescent, if they've reached puberty, we still treat them as an adult. So it's still going to be 2 inches. All right, so I said this before, do not delay CPR to give Narcan. If this person's in respiratory arrest, meaning that they have stopped breathing, if they're in cardiac arrest, meaning that they do not have a pulse, I need for you to begin CPR. CPR should take precedence over Narcan administration in persons without a palpable pulse. When you're feeling for a pulse, you want to feel for the carotid pulse. Look at the image on the screen. The person is using 2 fingers, their pointing finger and their middle finger, and they're in the groove of the neck. We're not going for the distal. We're not going for the extremities. We're not feeling for a radial pulse. And in emergency, you want to go for the pulse that's nearest the heart, which will be the carotid artery. All right, the recovery position. So this person, now our scenario has changed. This person you've administered Narcan to, they were not in cardiac or respiratory arrest. You want to get them on their side with their head supported. Because they may vomit. In this image, the person's head is kind of like in a neutral position. If you can have the head facing downward, it'll be a little bit better. That way, if there's any vomitus that comes up, it will be able to come out the mouth. And whenever you have someone in a recovery position, you still want to be monitoring them. If this person were to stop breathing or they were to have a cardiac emergency, you would simply lay them on their back and start CPR. And don't forget, 911 is on the phone with you. You have a dispatcher, so you're not alone. You're just helping to save this person's life until the professional rescuers get there. Right. So, what is harm reduction? And harm reduction is a set of practical strategies and ideals aimed at reducing negative consequences associated with drug use. Harm reduction incorporates a spectrum of strategies from safer use to managed use to abstinence to meet the drug users where they're at, addressing conditions of use along with the use itself. So, you're just the first link in the chain of survival for someone who may be using drugs. So if you have the Narcan, again, we'd rather you have it and you not need it than you need it and not have it. It's kind of like if for those people, if you're like me, you have a first aid kit in your car, you have gloves in your car because we don't know when an emergency is going to happen, but we do want to be good, citizens and help our fellow brethren out. So, harm reduction enables people to make safer and healthier choices. Narcan does not increase substance use. And so, I like this image because we have all of these fingers pointing at this person. Remember, whenever you point at somebody, there's three fingers pointing back at you. And so, we don't know what this person's, what her life is like. So, if she is using drugs, I'm not trying to judge her. I am trying to save her life so that we can give her the chance to actually go to a treatment center for recovery for her to get the help that she needs. And so by you learning how to administer Narcan, you're going to give that person a fighting chance. So now let's talk about the safe handling and the administration of naloxone or Narcan. So once you get your kits, and remember you can get your kits from Florida Training Academy, or if you stay until the end, I'll tell you how you can order your kits nearby if you're in the United States. Whenever you have your Narcan, you want to store it at room temperature and out of direct sunlight. You can keep it in your backpack or your purse. You can keep it inside of your coat, but do not avoid temperature extremes. Don't have it in your refrigerator, and also don't store it in your car. Your car can get hot and get cold, and we don't want the medication to become deactivated. Right. So how to administer Narcan? First, we're going to take it out of the pouch. We discussed this earlier. We're going to hold it within our fingers. We're going to insert it into the nostril, and we're going to press on the plunger firmly so that all the medication can be administered. And of course, this person has to still be breathing because it's intranasal. That's how a layperson can use it. This is not intravenous. So if they're not breathing, the medication is just going to sit in the back of the nose. So you cannot administer Narcan intranasally to someone who's already in respiratory or cardiac arrest. You would do those life-sustaining skills we talked about before, either rescue breathing or chest compressions. And whenever the EMS arrives, they would give Narcan intravenously. Okay, so educators, this is a good time for you to please pause the video to complete the hands-on teaching demonstration. If you have your CPR mannequins and your Narcan trainers, you can pause the video and now show your students how to actually administer Narcan hands-on, and resume the video once you finish with your demonstration. All right. So what to expect after the Narcan is administered? And again, I just want to keep apologizing. The streaming service I'm using is not showing the slides correctly. But after you administer Narcan, what do? Are we just staring at this person? I want to prepare you now so that you know what to expect and whether or not it's a positive or a negative outcome. I want you to be prepared. So if we're going to be reversing the effects of the opioids, and we talked about Narcan working by binding to the opioid receptors in the brain, effectively blocking the effects of the opioids, this can lead to a rapid reversal of the opioid-induced respiratory depression, which is the primary cause of overdose fatalities. So in other words, when you give Narcan, the person should start having an improvement in their breathing. Okay, so one of the most immediate and noticeable effects of Narcan is the restoration of normal breathing. If the person was experiencing shallow or slowed breathing, you should observe an improvement in their respiratory function. Awakening and increased alertness. So as the opioid effects are reversed, the individual may regain consciousness and become more alert. However, it's important to note that the person might still be disoriented or confused initially. So I want to prepare you for this confusion. This person had overdosed on drugs, and now you're giving them something that's going to bind their drugs up. They're not going to know where they are, where they're located. They're not going to know who you are. So remain calm, and let them them know, reassure them, reorient them, and let them know that help is en route. The possibility of agitation or withdrawal symptoms. So, the sudden reversal of opioid effects can lead to withdrawal symptoms. This may include agitation, nausea, vomiting, muscle aches, and other discomfort. While withdrawal symptoms are generally not life threatening, they can be distressing for the person. It can be distressing for you as the rescuer. All right. So, some people, they wake up calm, others do not. So, we want to prepare you for that. They could possibly be agitated, but we still want you to administer the Narcan if you suspect the person, is a victim of a drug overdose, and you have now on the phone and EMS is en route. All right, so the observation period. It's crucial to observe the person closely after administering Narcan. The duration of action for Narcan may be shorter than that of some opioids, so there is a risk of a potential return of overdose symptoms. Emergency medical services or EMS 911 should be called, and the person should be monitored until the professional help arrives. And then the post Narcan care. So, following Narcan administration, it's essential to seek emergency attention for individuals. So, some people who may be addicted to drugs, they already have the Narcan in their possession. And so, unfortunately, they're there with their other buddies, and their buddy will notice the overdose symptoms and administer Narcan, but they never call 911. Okay, we want this person to be seen by a professional, because even if the person appears to have fully recovered, they may still be at risk for recurrent overdose if the opioids are still in their system. And therefore, medical professionals can conduct a thorough assessment and provide appropriate care. This is a question I get asked often. What happens if Narcan is administered to an unresponsive person who did not use opioids? That's a very good question. So, administering Narcan to a person who has not used opioids or is not experienced an opioid overdose is generally considered safe, and there should be no harmful effects. Narcan works by binding to opioid receptors in the brain and blocking the effects of the opioid. So, if they didn't use opioids, it's not going to impact them negatively. It does not produce any significant side effects in individuals who have not used opioids. All right, so a common myth. I hear this one a lot also. Opioid addiction only affects certain demographics. That is definitely a myth. So, in reality, opioid addiction can impact individuals of any age, gender, race, ethnicity, and socioeconomic background. It is a widespread issue that does not discriminate. Remember, as I stated before, a lot of the street drugs are laced. They're laced with fentanyl. So, even if this person's just a casual marijuana user, if the marijuana is laced, then they could be a victim of a drug overdose due to opioids. Myth number 2, opioid addiction is a choice, not a medical condition. In reality, opioid addiction is a complex medical condition with both biological and environmental factors contributing to its development. It is not simply a result of poor choices, but involves changes in the brain that affect behavior and decision making. Myth number 3, prescription opioids are not dangerous. And we know that's a myth. All right. So, prescription opioids, when used improperly or without medical supervision, can be highly addictive and pose significant risk. The misuse of prescription opioids has been a contributing factor to the opioid epidemic. And so, if you have drugs that you have not used, we have to decrease the chances of these teens, the youth, getting access to these drugs. It's just been sitting in grandma's cabinets forever. So if you don't know what to do with the drugs, please contact your pharmacy, contact the fire department. I do know you're not supposed to pour it into the toilet, because that's going to contaminate our water supply. But there are safe ways where you can actually discard opioids, but you may have to contact your pharmacist so they can discuss those ways with you. But if you're no longer using the pain pills, please get rid of them. Myth number 4, Narcan enables drug use. Remember, Narcan is also known as naloxone. It is a life-saving medication that can reverse opioid overdoses. It does not encourage or enable drug use, but serves as an essential tool in preventing overdose deaths. Naloxone should be seen as a harm reduction strategy, allowing individuals a chance to survive and seek treatment. Remember, we're just that first link. We want to provide the emergency care they need, give them the Narcan, and then hopefully that person can get into a treatment center, so where they can actually receive help, where they can fight this addiction. The Good Samaritan Drug Overdose Act, or the 911 Good Samaritan Law. If you're in Florida, we have a Florida statute 893.21, which provides limited protections for the personal use of controlled substances and paraphernalia. If you're outside the state of Florida, please, when you have opportunity, pause the video. I want you to look up the Good Samaritan Drug Overdose Act for your state. The 911 Good Samaritan Law, also known as the Good Samaritan Drug Overdose Act in some jurisdictions, is a legal provision designed to encourage individuals to seek emergency medical assistance for someone experiencing a drug overdose without fear of legal repercussions for certain drug-related offenses. The intent behind these laws is to prioritize saving lives by removing barriers that might prevent people from calling for help in overdose situations. So it's okay to call, if you're using drugs with a friend, it's okay to call 911 to get help for your friend. And we're not trying to prosecute you. We're trying to save your friend's life. So that is what the 911 Good Samaritan Law is, to help you to help others. So some of the key features of the 911 Good Samaritan Law typically include limited immunity from prosecution. The laws generally provide limited immunity from prosecution for certain drug-related offenses, such as possession or use, to the person seeking medical assistance for an overdose victim. Number 2, conditions for immunity. Immunity is usually granted on condition that the person seeking help cooperates with medical professionals and law enforcement, and that the overdose situation was reported in good faith. Number 3, protection for the overdose victim. Some laws also provide protection for certain drug-related charges for the overdose victim. Our job is, we're not trying to arrest you. We want you to get help. We want you to live. So arresting you is not going to help you with your addiction. Right. And if you know of someone who is struggling with drug addiction in the United States, there are valuable resources and helplines available to provide support and assistance. Here are some of the options. So we have the National Helpline. The Substance Abuse and Mental Health Services Administration provides a free confidential helpline that's available 24/7. The phone number that you would call is 1-800-662-HELP or 4357 for assistance and information about treatment options. That would be one resource if you know someone who is addicted to drugs. Another resource will be your local mental health and substance abuse services. You can also call Narcotics Anonymous. You can get their phone number by going to na.org. Alcoholics Anonymous, while they primarily focus on alcohol addiction, they do have meetings and can provide support for individuals dealing with drug addiction. So when you have someone who's addicted to drugs, oftentimes they're also addicted to alcohol. So whatever community resources you can find that are free of charge or, reduced costs to help this person, please reach out to them. So whether it's Narcotics Anonymous or Alcohol Anonymous, you can reach out to either. Your local healthcare provider. So consult with your healthcare provider, your doctor, for guidance on treatment options. They can provide referrals to specialists or treatment facilities. And then we also have community health centers, which are low cost or free of charge. If you are having a crisis, or if you know someone who's having a crisis, you can text HELLO to 741-741 to connect with a trained crisis counselor. While not specifically focused on substance abuse, this service can provide support during difficult times. And I think we forget about the family caregiver. So if you're the family caregiver and your teen is addicted to opioids, you need help. You need resources. So you may not just be reaching out to the crisis text line for your child. You could be reaching out for yourself. Right. And so, how to obtain your free Narcan kits? You can contact your local fire department. You can also visit www.narcan.com. They have resources, they have education on their website. If you're an educator, you can request a free Narcan training kit. But that way, when you go to the resources, you can find the local distributors of the Narcan kit. You can let them know about the video that you saw on YouTube. So, this should cover your training, and you just need like the hands-on training, and you would be able to receive the Narcan and administer it, and hopefully you'll feel more comfortable doing so. If you're in Jacksonville, if you're in Florida, you can just email me, Florida Training Academy. My email address is admin@fltraining.com. And again, if you take our CPR BLS courses, we're giving all of our students the Narcan kits so that they can go out and help save others. Right, and so now we're almost towards the end of our presentation. I need for you to take out your phones, open up the camera app, and I want you to do the post test. I hope that you found this presentation beneficial, and that you would be more likely to utilize Narcan to help save someone's life and be better prepared in case of a drug overdose emergency. And my slide just is not showing correctly, but my website is fltraining.com. And if you have any questions, you can just leave a comment. We look forward to seeing you in the next video, everybody. Thank you for being a lifesaver.